students, so I welcome you all in entering in one of the biggest phase of your life from a medical student to a full-fledged doctor. Congratulations on becoming a budding dermatologist. Dermatology is a great field. You can keep a right balance between your clinical work and your life without too much of stress. So for which today I have invited Dr. Ananta Khurana. Dr. Ananta Khurana is the Associate Professor in Dermatology at RML and PGIMER, New Delhi. She's been interacting with the residents on day-to-day basis. The RML Institute has one of the premier institute for the Dermatology Residency in Delhi. And let us hear from her that what are the do's and don'ts in the Dermatology Residency, what is expected from a Dermatology resident. So welcome, Dr. Ananta.
Thank you.
So Ananta, can you just tell that those students who will be starting the Dermatology Residency, that what should they focus on, what they should read, and what are their key focus areas when they are starting the Dermatology Residency?
Okay, first of all, congratulations on picking up a very interesting branch. So dermatology, as apart from the other specialities of medicine, it's a very visual field. So most of the diagnosis we make on direct clinical examination, right? So there is very less dependence on other specialities, except for pathology maybe.
Yeah, so we keep on saying this, that all these specialities are dependent on radiology for the diagnosis. But this is dermatology, which is one branch which is not dependent on radiology for the diagnosis.
Right. So first and foremost, you stock up on the books. See, basically dermatology we divide into the general dermatology, there is STDs and leprosy. So that all these three form the your MD curriculum of the 3 years. So for general dermatology, you have the foremost books, the Bible of Dermatology, Rook's Textbook of Dermatology. Its new editions come once every 4 years, so you can check on that. So that's an absolute essential. Then there's a Fitzpatrick Dermatology in General Medicine. That's extremely useful. So keep these 2 books as your primary books, right? Then there are some lesser texts, shorter texts which you can use, like there is Andrew's Diseases of the Skin. So these are the ones you must have, and just to brush up on your knowledge of dermatology before you enter MD or probably in the first few weeks, there is a small text of about 500 pages. It's a textbook of dermatology and STIs by Dr. Kabir Shardana. You could probably give that a read. That would be quite useful. Second part is leprosy. So for leprosy, there are 2 old texts which are very useful and must-haves and must reads. The first one is the Handbook of Leprosy by Jopling. It's a very old text. In fact, we are in the process of updating it to a recent updated edition, and that should be out in August or September probably. And apart from Jopling's, there is another old text by Hastings, and that's very useful. So probably in the first year, these 2 basic texts should be enough for leprosy. Later on, you can go to more extensive tests, reviews, and articles. Then coming to STDs, generally in dermatology, STDs postings would be second year or onwards, but then some exposure to STD clinic would occur in the first year as well. So for that aspect, the best for starting is there is this PDF you find on the CDC site. It's a free downloadable PDF. They update it every few years. So that gives you a broad idea about the clinical features management for each individual STIs, and that's a very good read for starting. Then there is another old text in STDs as well. It's called, it's by the name of King Nichols. Very old text, but very useful for clinical part. Like for all these old texts, don't go for the treatment part because that keeps updating and it's as per the national programs and other things. But the clinical part is really good in all of these. And later on through second and third years, you can go on to the bigger text of STD, the Holmes textbook of STIs, which is like the Bible of STDs. Right, and in dermatology, we give a lot of importance to the drugs. Like drugs used in dermatology form a very different groups. The topicals, which are almost only used in dermatology, and there are many systemic drugs. A lot of immunosuppressive steroids we use. So we are very fond of, asking about drugs, and that is one thing you should know and keep brushing up again and again. And in fact, there is a separate textbook on drugs in dermatology by the name of Walberton. So that's another must-have. Right, and plus you should get used to the habit of using PubMed. Search on that, updated articles, reviews, trials and everything that you add to your usual texts. So that's very helpful. Please do not Google or read Wikipedia. These are not useful sources, not reliable sources of information. Up to date is a good one if you have access to that, but your standard books first before anything else.
So I think a very well framed and structured advice that these are the must-know books for everybody. But see, I believe that as you are moving toward the residency, one of the biggest change that has happened in your life, that you are moving from a structured way of teaching to read whatever that you want to read, because now there is no fixed course. Now you are treating the patients. So whatever Dr. Ananta has suggested are the one that are the must-know books, because that will give you a comprehensive idea about the subject overall. But I feel that there is no limit to the knowledge.
Yeah, these are just the standard books to refer to at all time. Yeah, you must always keep on adding. In fact, it is a good idea. You should make notes about each topic. Once you read from these books, you put them there. Then you add on information as you go through your residency from different sources, and let it all be there at one place, for the final third years. So that's a good idea.
Yeah, and Ananta, how should one begin? So these are the books that you have talked. So how should one begin and successfully go through the 3 years in the dermatology residency?
See, once you enter first year, the most part of the first year would be divided into your minor OT postings, wards and OPDs. And it's in most of the institutes, it's like that. There may be some variation. So initial part might be in minor OT or ward, and both have, many things you can learn there. So minor OT, you get to learn about all the regular procedures, but many take it as a punishment posting, but it is not. There's a lot of theory which goes behind all the procedures. So, try to focus on that during your posting in minor OT. And plus, you get to see all the different cases which are sent to you for biopsies. You can always go back and discuss with the respective consultant or SR who sent the case, why this particular diagnosis, why not that. You can read about this. And then in dermatology, we lay a lot of stress on description of lesions, primary, secondary lesions, the nomenclature, terminology. So see what the person who has sent you the biopsy uses to describe that lesion, and those things you should brush up on and try to grasp early in residency. That help you a lot throughout. So the first few chapters of the standard text, and these are very important, they take you through. Then in wards, the inpatient management in dermatology is a completely different ball game. So basically there are a few broad categories of conditions or diseases which form most of our admissions, like there's erythroderma, immunobullous, leprosy reaction, psoriasis. So you, as you progress through your ward posting, you try to read up on these, the drugs used in each of these. And mind you, a lot of your internal medicine training through the MBBS and internship is going to be of use here in inpatient management in dermatology. Right, so brush up on that part as well. Right.
Okay. So that is about how the postings are being managed. Ananta, when the people join dermatology, so I might be wrong, but that is my perception, that people are picking up dermatology thinking in mind about the cosmetology part of the dermatology.
Right.
Okay, all that glorification that dermatology has got over a period of time is the beautification, and is predominantly because of the cosmetology. So how the students are exposed to the cosmetology during the residency, and how should one focus or about the cosmetology during the dermatology residency?
See, when we say cosmetology, we are basically, just to be clear, talking of practices and procedures which are done just to improve the cosmetics, the aesthetics of a person, where you're not treating any dermatological disorder or condition or any sequelae of these thereof. So this is completely separate from what we talk of dermatosurgery, which is a core integral part of dermatology MD curriculum. Right, so for cosmetology, I mean, there are many specialities who lay claim to this domain, and for whatever it's worth in your practice post residency, it should not be the primary focus area, during the 3 years of your MD. Like cosmetology is more for clients than patients, so you must first learn to treat diseases, to treat patients before going on to that aspect. You can explore that more during your SR-ship, or you can attend workshops and conferences and learn that. But these 3 years of MD, please use it to achieve clinical competence, which you would not gain, by
learn
this.
dermatology.
Yes, that doesn't come after MD really.
So there are like lot of time I get this doubt from the students is that I have joined dermatology at such a such place, and one of the equipment is not available. Let's say the lasers are not available. So how important are the lasers in your practice, and what is the role of lasers in the dermatology at the residency level?
See, lasers, it sounds like a very fancy term to someone who is not exposed to it. But it's, if your institute doesn't have these, it's not a handicap at all. You know, like during the 3 years of MD, you should learn to focus on the basics of lasers, the science behind it, what conditions to use it for and what not to use it for. Like, these machines are very user friendly. There is no great art or science in operating them. So once you know the theory behind it, what to use it in, what dose to use it in, there's nothing much in really operating the machine. So it's not a major handicap that your center doesn't have a laser, right? So like as you go further through your MD, you'll realize that there is only a small list of conditions in dermatology for which lasers are the only modality or the primary modality of treatment. And even for most of these, it's not the be all and end all of treatment, right? So like there are some conditions which are highly responsive, many are moderately responsive, and some are very less responsive within this subset. So don't consider that as a handicap, and it's something you, the basics of it you learn here, the fundamentals, the science of it you should focus on in MD. And even if you don't have that, operating the machine is not a big thing. You know, it is nothing you are losing on.
Okay. So that means it is not something that if it is not present in your hospital, so that will devoid you of a major part of your dermatology residency. Okay. So very well, very aptly said. So this is just to tell those students who are doing a DNV course or a dermatology residency at a place where the place is not very well equipped. So don't worry about that. You can make your theory part pretty strong. You can learn the physics behind it. You can learn onto the content, and then later on, depending on your interest, you can do the senior residency from a place where these things are available, and you can utilize your theoretical knowledge that you have gained in your residency, and then can get more experience or the hands-on experience on all those aspects. So you said that don't Google and don't use Wikipedia. Yeah, I think that's a very well said advice. But what about the online sources? You said PubMed. So is there any other special online sources? Like in our radiology, we have got a lot of websites which are dedicated to the radiology teaching. So do we have such kind of online resources which are available for free or for on some charges to the resident?
This is not particularly like that. I mean, you should be PubMed savvy, and whatever you read, PubMed at once, you know, whatever the latest, because books are revised every few years, and between that few years, a lot of things would have come up. So, you know, keep yourself updated between what has happened after the book was published in the years that followed. And apart from that, the online sources up to date is one which you can use if you have access to or your institute provides access to. But if you don't and you can't get that access, it's okay. I mean, the usual text and PubMed, they give you everything.
Okay. All right. A lot of people nowadays are trying to move toward the research. So what are the research opportunities that are there in the dermatology, and how one should capitalize on those? Like there are a lot of places where they are doing a good research at the medical college level, but on the other hand, there are a lot of places where the environment in the institute is not up to the mark as per the research level. So what opportunities that one can have on that?
So during MD, you have research opportunity in the form of your thesis you do. So be very involved in choosing the topic, and you know, very diligently you do the thesis, recording patient data. I mean, that's your first exposure to research, which is a integral part of MD in any specialty for that matter. And apart from that, I mean, there are numerous research options in dermatology. Like we broadly have these three specialties: the general dermatology, STIs, and leprosy. They are such broad fields in themselves. Like you just need to have an inquisitive mind, and there's so much to be done. Like whatever treatment we use, large part of that is based on anecdotal evidence, right? So there's a lot to explore, a lot to, you know, do, and evidence to be generated on that aspect. So if you have an inquisitive mind, I mean, it doesn't take much to start a small project. Start from any small projects, any case series, and you can build that up.
Okay. Any society affiliations that one should have during the residency?
Our national association, the IADVL, you must be a member. You need the membership to subscribe to the journals, the three journals of the two journals of the society, and plus for paper and poster presentations at the regional, zonal and national conferences, you need to be members. So you're provisional life members once you enter MD. And the rest of the association, it's as per your interest. Yes.
So one of the biggest questions for which I have actually invited you is, what are the common problems that a resident face, specifically in the first year of residency, and how one can overcome those problems?
So from MBBS to MD, it's a big leap. You know, there's a change in the structure of education which happens. So you don't have the spoon feeding, the lecture teaching which used to be there in MBBS. So the knowledge you gain is for what you go out to and seek and learn, right? So you gain as much as you want to gain, as much as you seek, right? So you will learn from your seniors, from your senior PGs, SRs, consultants, just grasp everything you can from everyone, right? Everyone has their own experiences to share, their own set of treatments which they follow, and there are pros and cons with every approach. So just go out, interact with everyone, take in everyone's approaches, and you decide the best approach for yourself. And of course, don't restrict your knowledge to any one book, to any one source, to any one person. You know, just interact with everyone. You search any topic you want to, focus on, just extensively search for it. Take your seminars and the journal clubs you present very seriously, because, you know, that's one point you would extensively search and look out for a particular topic. You just make notes and keep that with you forever. So that's like a source to read from, you know, for future, for third year, for exam as well. So that's one thing. Basically, don't let your approach be too exam oriented as well. I mean, just don't focus on this is important for exam and this is not. Just especially in the first 2 years, there's a lot to learn, lot to explore. So don't have a tunnel vision towards the exam. But as you come towards the third years, of course, exams they become a point you have to consider for everything, right? So take your case discussions, case presentations very seriously. Read up about a topic, whatever you're presenting, and try to keep presenting, because in dermatology, like I said, how you describe the lesions, the presentation, that part is very important for exams. There are certain texts you can, especially designed for dermatology exams, like there is a compendium of dermatology which is coming up. So these are the texts you can read, specifically exam-oriented approach.
Okay. All right. So one of the biggest reason that people pick up dermatology is that they need not to go for a super specialization. Okay. But on the other hand, there are few people who, after joining dermatology, they also have focused mind. They want to read more, and they may want to go for some super specialization. So do we have options of super specialization in dermatology?
Well, there is no structured super speciality like in medicine or surgery in dermatology, because it's like an end branch, right? But there are many, you can form your interest zones and go further in that. Like as for super speciality, there are some fellowships which have just been approved by the National Society on Dermatosurgery and Pediatric Dermatology, and they would be coming up in due course of time, FNBs in that. And apart from that, there are many observerships which every year they come out in by IADVL in different subspecialties. There's some in phototherapy and urticaria, in cosmetology if you're interested in that. So these are the arenas you can explore post your dermatology. Yeah.
Okay. So there are a lot of students who are appearing for the MD exam, and there are a lot of students who have joined a DNB course. And there are some doubts that student has in the mind that the DNB courses are slightly inferior. So you have appeared for both the exams. So what is your take on that particular part?
See, exam-wise, the overall stress and the things are almost the same, just that the DNB pattern is much more structured than an MD exam. The focus areas are almost similar. And the practical exam, the headings under which the exam is conducted, it is also same as MD. There is not much difference between DNB and MD on that aspect. But yes, the DNB exam is much more structured, especially the theory part. So otherwise there is no advantage or disadvantage. I mean, both the exams per se, they are equivalent.
Yeah, what I feel is like if you see the MD exam, why? Because like if you see an MD exam, in an MD exam there are two external who are coming to check your vivas, whereas there are two internals who are also sitting over there. And so the external people who are taking your exam, they don't know you, but the internal is sitting over there, they tend to know you. So even because exam is a day of stress, we all know, irrespective of how good you are with your subject, it may not be your day and you have not performed pretty well on that particular day. So in the MD exam, because the internal who has seen you over a period of 3 years, so they are there to help you out much more in comparison to the DNB exam, and that is why it is said that it's slightly easier to pass the MD exam. But on the other hand, if you look at a DNB exam, you are giving the exam in front of an external who doesn't know you at all. Okay, so but if you see this, that if it's a DNB exam, if you know your subject well, if you are confident about your subject, you will pass the exam. See, gone were the days when the passing percentage of the DNB used to be extremely low. The reason behind that was that at that point of time it was a non-merit based kind of system. But now the DNB is a merit based system. So even somebody has picked up a DNB, you have got a sound knowledge of the subject, no need to worry about that, you will do pretty well. Just keep your focus right, just keep your approach right. Dr. Ananta has already suggested you some great books. So make sure that you are reading that books. But please remember, knowledge is never limited. One of the biggest thing that I feel about a PG entrance, a difference between a PG entrance exam and your post graduation is there is an upper limit in a PG entrance exam. Sky is the limit in your PG. You can read whatever you want, but the pattern will remain same. First, make your basics strong and then move ahead. Your understanding about the disease should be absolutely right, and once your understanding is right, then sky is the limit. You can learn about a disease in as much depth and as much detail as possible. So if your basics are strong, irrespective whether it's an MD exam, irrespective whether it's a DNB exam, you will definitely be able to crack the exam without a doubt. Just keep focused, just make sure that you are regular with your subject, make a roadmap onto the things that you are planning to do. Okay, as far as this super specialization cosmetology goes, don't worry too much about that. You have picked up dermatology because you wanted to give more priority to your life. Okay, so just live your life, stay healthy, please take care of your health. Okay, all these things are extremely important in your life ahead. If you are entering into a new city, there might be some adjustment problems that you come across. If you're moving to a city where your native language is not there, try to learn that particular language. Okay, it will be very helpful for you, because dermatology is again all about interacting with the patient, talking to the patient, be compassionate with the patient, try to talk to them in as much detail as possible, and I'm sure that you are having a great life ahead as a dermatologist. If you have any more questions, feel free to talk to me. I will keep talking to you, I will connecting you, I will sending the details of the books to all of you. Just let us know if you come across any problem in the life ahead. With this, I thank you, Dr. Ananta, for sparing your valuable time.
Thank you.
Thank you very much.